Our VEGA Oral Care Recovery Kit is started 3 days before using all 3 products 3 times a day. And this is done before surgical procedures or scaling and root planing procedure. For patients who are suffering from lichen planus, the recovery kit, mucositis, the recovery kit, and angular cheilitis. It builds up a therapeutic level preoperatively. It takes advantage of the healing and calming properties of Ignatia and Camellia. It gets the patient familiar with the use of the products before the procedures. And it also gives the patient an application guide to follow each step correctly in order. Rinse first, spray second, place the gel, and do not wash off the gel for 20 to 30 minutes. Again, step 1, VEGA rinse. They measure out about a half a tablespoon and swish for 1 to 2 minutes and spit out. They can also apply it directly to an implant site or a surgical site with a Q-tip. 3 times a day when there's active disease or active infection, preferably after eating, and then no eating or drinking for at least 20 minutes to maximize the absorption. Our VEGA spray is 3 to 4 times per day, 4 sprays under the tongue, waiting 20 to 30 minutes before eating or drinking. And our VEGA gel, apply to the mucogingival area with a Q-tip 3 to 4 times a day. When starting 3 days before the procedure, apply to the area where the surgery will take place, and then continue 3 to 4 times a day post-operatively for 7 days. No eating or drinking for at least 20 minutes to maximize the absorption.